Hey, happy 4th of July. This is Dr. Susan Wilder doing a little COVID update video for the holiday weekend. Unfortunately, wow, the United States just hit a terrifying landmark of 50,000 new COVID cases in a single day. So far, over 130,000 Americans have died in just a few months, and every one of them is a parent or a child, a sibling, or a friend, a spouse, a coworker, or a caregiver. So it's a really devastating problem, and it's not something we can ignore. And though we were just over 4% of the world's population, the United States has claimed 25% of confirmed COVID deaths. And yes, some nations are not reporting their deaths accurately, nor did we, because we were not testing many patients in the first months of this illness. But 25% of the global mortality currently belongs to the United States, and that is shameful. As cases are skyrocketing in dozens of states, with Arizona being really the hotspot of the planet right now, Maricopa County alone has hit over 50,000 COVID cases. That's more than 34 other states and the District of Columbia. We are now the pariah, the undesirables, the persona non grata. The EU has already disallowed non-essential travel from United States citizens, and several states are requiring quarantine of any travelers coming from Arizona. Because frankly, we blew it. And we will endure the health and the economic fallout from this for a much longer period of time compared to those nations who address this decisively. Our outbreak in the United States started the same week as that in South Korea, yet we have 70 times the COVID mortality per capita of that little nation. Now, they had the SARS outbreak, they were prepared, and they acted quickly and decisively. Well, we did not. You know, why is our mortality per capita 70-fold higher than South Korea? We failed to take this seriously. We delayed at every level and every step of the way. We went into denial. If we stick our head in the sands, maybe this will go away. Ignorance of established pandemic guidelines and of scientific recommendations, disinformation and divisiveness, and for some, a selfish entitlement attitude that my liberty trumps your life. And we have the right to remain ignorant, misguided, misinformed, and divided. Or we can get our collective act together, engage in some personal discipline, challenge disinformation, cooperate respectively, and beat this thing. As George Bernard Shaw stated, liberty means responsibility. That is why most men dread it. Now I want to unmask some of the myths still going around. Number one myth: masks don't work. Studies confirm transmission of COVID-19 virus was reduced 85% with any face mask use. They estimate that we've already deferred at least 250,000 to 500,000 COVID cases with mask use thus far. And if just 70% of us wore masks reliably, we could drive the R0, that number of people infected by each infected person, to less than 1. And that is how you drive a virus out of a population. Ask them in New Zealand, they managed to do that. To work, masks have to cover the nose and the mouth. I can't tell you how many people I see with their nose hanging out of their mask. They should have at least 2 layers of fabric. Quilting fabric looks to be among the most effective. However, even a scarf or a bandana is better than nothing. Cloth masks have to be washed regularly after each use, and surgical masks should be disposed of after each use or can be laundered a few times, but that's about it. They will lose their effectiveness with each washing. Clear face shields can be used in addition to masks for people at very high risk, so blocks virus from entering the eyes or the face. They can also be used in those who just for whatever reason cannot tolerate a mask. Either they need oxygen, they are for young children. Some schools are looking at the possibility of just using the clear face shields because it allows full facial expression, reading of lips, that type of thing. Other myth is that masks reduce your oxygen, increase your carbon dioxide, or your risk of recycling the virus. This is absolute nonsense. Unless you have severe lung disease, in which case you better be staying home, or you spend hours in a fit-tested medical N95 mask. Tests prove there is no reduction of oxygen, no significant CO2 buildup. If you are infected, there is no evidence that wearing a mask will prolong or worsen your illness. And if you are infected, again, stay home. You should not be out. You should be isolating at home and isolating within your home from other family members. If a claustrophobic asthmatic like me can wear an N95 mask for 12 hours, then I think just about anyone can get used to this. You actually adapt. Watch children. I've seen many children in the airport yesterday over the age of 2. These masks are not recommended under the age of 2, but I've seen lots of little children, age 3, 4, 5, who do fine with masks. It is not a big deal. We can learn a lot from their resilience. Another myth is that those who got this without symptoms aren't as infectious. Actually, the symptoms are an indicator of how well your immune is responding to this virus. And studies show that those with asymptomatic infection shed the virus longer, upwards of 19 days, almost 3 weeks. So while most with symptoms shed the virus for 7 to 10 days. Myth, we should just let this blow through the community and get to herd immunity quicker. First failed in Sweden, and you do the math. With over 130,000 dead and less than 10% of the community infected, how many are we willing to sacrifice to get to 60 to 70% immunity? That number is inconceivable and inappropriate. This virus kills 1 in 20 of those infected over age 65. I'm not willing to risk my loved ones. Are you? And does it make any sense to let this blow through before we have any real clue as how to best treat this and what are the long-term consequences? I can tell you, none of us in medicine, although we'd love to have this all behind us, none of us want to get this before we truly understand how to treat it. Another myth is that COVID poses no risk to young people or children. Fact, we are just learning about the long-term consequences like chronic fatigue, dizziness, headaches, muscle weakness, lung scarring, blood clots, strokes, inflammatory heart, vascular, and neurologic complications in young people and children, even months after mild or asymptomatic infection. So anyone who thinks it's funny to print out a fake ADA mask excuse card or throw a COVID party, think again. You are playing Russian roulette. Would you do that if it meant maybe one of your friends might end up with a stroke, paralyzed by a stroke, or have severe shortness of breath after running a mile, or endure a fatal blood clot, or a demyelinating disease like MS? And right now, our hospitals and ICUs are full of 20 to 40-year-olds who wish they took this seriously. Final myth is remdesivir is our magic bullet. Once we have a vaccine, everything will go back to normal. There will be no magic bullet. Remdesivir will be one of many tools that will help us battle infection at various stages in various people. It will not work in anyone, and it will not work at every stage. And vaccines are promising, but those at the highest risk by age, by chronic disease or immune dysfunction are not good vaccine candidates. And a lot of people forego vaccines, so we will have a challenge there as well. As we've stated repeatedly, our biggest risk is our baseline health, over which we have tremendous control. I was so pleased at how many people turned out for our 10-day metabolic reset and renew, which is a tremendously immune boosting supportive program. We can choose to be passive victims or active warriors against this, and any vaccine or treatment works best for those of us who've accepted some personal responsibility and engaged discipline to ensure our immune system is as optimal as possible. So as we head into this holiday weekend, please don't be a COVIDiot. Socially distance, avoid large gatherings, wear a mask, and behave as if you treasure your health and that of every American as much as we do. If you know anyone who is struggling right now with COVID illness, acute COVID infection themselves, please check out our intensive 3-month program with Dr. McMillan, where we support people every step of the way through the terrifying process of hospitalization and getting back to perfect health, hopefully. Anyone interested can contact Alicia at afortune@lifescapepremier.com. We are always here for you, and also excited to announce that we will have rapid COVID antigen tests available within the next week that give us accurate results within 30 minutes to an hour. So super excited to have that kind of help available. Please reach out with your questions. Please take care of each other and have a happy, healthy 4th of July.